One day, I saw my child playing with a Lego car. The wheel was stuck and wouldn't spin until it was placed on the axle, then it rotated smoothly. That moment inspired me. In cataract surgery, when the lens is stuck in capsule or without enough zonular support, central fixation like an axle may allow safe and effective rotation. So, that's the idea of hold and rotate, an approach to rescue the unrotatable nucleus. When the nucleus remains unrotatable during phacoemulsification, several strategies can be employed to proceed safely. By manual rotation using a second instrument alongside the chopper may facilitate mobilization. Alternatively, flipping the nucleus out of the capsular bag for chopping, performing hydrodelineation to cleave the nucleus, or using viscodissection to separate residual cortical capsular adhesions can be effective. Another approach involves removing a small nuclear fragment to debulk the lens, thereby enabling rotation of the remaining nucleus. Additionally, the hold and rotate technique can be employed, which involves firmly aspirating the central nucleus with the phaco tip, followed by mechanical rotation using a chopper. This method ensures controlled and safe mobilization of the nucleus, even in challenging cases. Let's take a look at how to perform the hold and rotate technique. My settings are as follows: intraocular pressure at 36 mm of mercury, aspiration flow rate at 32 milliliters per minute, and vacuum fixed at 550 mm of mercury. The vacuum must be sufficiently high to ensure stable fixation of the nucleus. To begin, I fully embed the phaco tip into the central nucleus until complete occlusion is achieved. By holding the foot pedal at position 2, a stable vacuum of 550 mm of mercury is maintained. Next, I use the chopper to engage the peripheral edge of the nucleus and apply gentle clockwise rotation. This maneuver allows the nucleus to rotate smoothly just like a wheel turning effortlessly around a stable axle. Let's see the hold and rotate technique again. The key to the hold and rotate technique lies in achieving firm central fixation of the nucleus using sufficient vacuum, maybe around 550 mm of mercury. This central fixation functions like an axle, providing a stable pivot point that allows the nucleus to rotate smoothly, much like a wheel turning around its center. To achieve this, the phaco tip must be embedded into the deep central portion of the nucleus until full occlusion is attained. Once stable, the chopper is used to apply gentle rotational force at the periphery, creating a lever-like effect that mobilizes the nucleus. It's crucial to avoid pushing, lifting, or tilting the nucleus during this step, as such movements may induce suction loss of phaco tip. By maintaining steady vacuum and avoiding unnecessary mechanical stress, this technique enables controlled, efficient rotation of the lens within the capsular bag even in eyes with poor zonular support or dense cortical fibrosis. This method enhances both safety and effectiveness in complex cataract cases. This is a 69-year-old female patient with dense posterior subcapsular opacity who underwent femtosecond laser-assisted cataract surgery. Despite successful laser capsulotomy and lens fragmentation, the nucleus remained resistant to rotation following hydrodissection. This phenomenon is not uncommon, particularly in cases with dense posterior subcapsular opacity, where residual cortical adhesions or incomplete cleavage planes may limit nuclear mobility. To address this, I employed the hold and rotate technique. The phaco tip was used to securely fixate the central nucleus under vacuum, creating a stable point of contact. Then, controlled rotational force was applied with the chopper to gently overcome the resistance and release the adhesions between the cortex and capsule. With this maneuver, full nuclear rotation was successfully achieved, allowing safe continuation of phacoemulsification. This case demonstrates that the hold and rotate technique remains highly effective even in FLACS procedures, particularly when nuclear mobility is unexpectedly compromised. This 68-year-old patient exhibited signs of significant zonular laxity, evident as peripheral lens instability during hydrodissection. Although hydrodissection was successfully performed, underlying zonular weakness remained apparent. In such cases, forceful rotation can significantly increase the risk of zonular dehiscence, potentially resulting in capsular rupture and complicating surgical management. To manage this situation safely, I utilized the hold and rotate technique. By applying aspiration with the phaco tip, the central nucleus was gently stabilized without exerting peripheral stress. Subsequently, controlled rotational movement was applied using the chopper, allowing gradual mobilization of the lens. This approach minimized traction on the weakened zonules and preserved capsular integrity throughout the procedure. The hold and rotate technique proved particularly valuable in this case, providing a stable, low-stress method for achieving lens rotation in the setting of zonular compromise. In this final case, the patient was a 67-year-old with a history of prior ocular trauma and mild phacodonesis, indicative of subtle zonular compromise. Hydrodissection was performed with caution, and slight lens instability was observed intraoperatively, confirming the presence of zonular laxity. Although a clear fluid wave was achieved, the nucleus remained resistant to rotation, probably due to weakened zonular support and dense nucleus. To address this safely, the hold and rotate technique was employed. The phaco tip was used to gently fixate the central nucleus under vacuum, providing a stable point of control. Careful, low-torque rotational movement was then applied using the chopper to gradually mobilize the nucleus without transmitting excessive stress to the capsular bag or zonules. This method enabled safe and controlled nuclear rotation despite the underlying instability. Phacoemulsification was completed uneventfully, and a trifocal intraocular lens was implanted with excellent centration and postoperative stability. In conclusion, the hold and rotate technique provides a safe and effective solution for unrotatable nucleus. It requires no additional instruments and can be seamlessly integrated into standard phaco chop procedures.